Today I'm bringing you the highly anticipated, one of my favorite topics, the anatomy of the heart. I'm a very massive keener on when it comes down to the heart and learning more about the heart. And the heart is one of the most powerful organs within the body. So as you know, if it stops beating and there's no blood circulation there will be no circulation of blood around systemic circulation, which means your cells deprive of oxygen, glucose, and various other metabolic um, needs that they have. But the heart is very complex in terms of when we think of anatomy, it's mainly completely made up of muscle. It's a muscular structure. And why I like it so much is because it's very complex, and when people refer to the heart, it's almost as if it's the engine of the human body, like how we would refer to the engine of the car is very important. So on the left here we have a 3D model of the heart. So you get a feel of what it looks like and how it actually works, and then there's a dissected version as well, which shows the muscles, the valves, and so on. And we'll go into a bit more detail. But on the right we have the detailed anatomical view of the heart. So we have a cross section here, and we have a posterior surface view as well. So this is the anterior view of the heart. Here's the posterior view. Here's a lateral view. So the image that you're seeing there, it is the posterior view, so it's the same as that. The lateral view is here, so when you're looking at across the side. The medial view, and the superior, so now you can see the arch of the aorta and the various different types of valves that come off it. Then the inferior view shows the bottom, right, which is the apex. Now if we go back to the anterior view, we know the heart is a muscular ball. And before I go into the compartments and the different arrangements of the muscular wall of the heart, I'd just like to go over some basic anatomy, so the surface anatomy of what you see there on the screen right now. So you get a hang of, and then I'd like to go through the coronary arteries and the coronary veins that supply the heart. So let's start off with an anterior view. So here we have major structure that you want to be aware of is this side, this thing here, which looks like an earlobe, which is the right atrium. What you have here, this butterfly shaped thing, if I switch around here, is the left atrium. Now in the front, what we have is the right atrium here, right ventricle, and then over here we have the left ventricle. So if I was to swing this back around, in the posterior view, you can see the atriums and you can see the ventricles. So as I said before, if we go to anterior, this is the right atrium, this is the left atrium. So if you go back, right atrium, left atrium. Now we'll discuss all these different valves in a bit more detail. So in the front over here, if this is the right atrium, then clearly this has to be the right ventricle. And then towards this side, so this reddish bit here, it's the right ventricle, and this bit here, it's the left ventricle shown on this side, and then the right ventricle is all of this side. Excuse me, sorry, I'm losing my voice somehow. Right, so if we go head over to the posterior view now, it's the same as what we see on the right here. So here we have the arch of the aorta. So the aorta is a red thing coloured here, and it takes the blood away from the left ventricle and towards the systemic circulation, towards the all bodies. Now you have three valves which come off the aorta on top. And if I was to go back to the anterior view, We have 1, 2, and 3, and I'll go through each of them in a bit more detail. For now, all you need to know is the arch of the aorta is this, it's got an arch. It's the big tube, and it's very, very high pressure blood and high velocity that travels through it. It has a very large elastic surface as well, so it can recoil, and it contains valves as well. Now over here, what we have is the pulmonary trunk, so that takes the blood away from the right ventricle into the lungs. And this massive one, again, to reiterate, is the arch of the aorta. That takes the blood from the left ventricle towards the body. Now, around the back, over here we have the superior vena cava, and if you were to look down, this is superior vena cava, and that brings blood back into the body. And then we have something known as the coronary sinus, which can be shown if we were to spin something. Yeah. So this is the inferior vena cava here on the top, the superior vena cava, and the inferior will be from the bottom. This right here is coronary sinus, and that's shown here. That drains blood into the right ventricle from the heart. Now, I'm extremely sorry. What I was meant to say was coronary sinus is this blue thing, the blue artery here. This circular hollow here is the inferior vena cava, so that brings blood from deoxygenated blood. And this over here is the superior vena cava, so this brings blood from the body, and the superior vena cava drains blood from the upper limb and the upper regions of upper extremities of the body, so from the brain, the skull, the neck, all of that. So hopefully you get a simple idea. So blood comes from the, imagine the head where the mouse is now, is over here. Blood flows down through here into the right ventricle, and then blood from the body enters via the inferior vena cava, which is this. Now, the main things that you want to be aware of is, so if you revert back to the posterior view, what we can see here is the left atrium has 1, 2, 3, 4 valves that come off it. You might be wondering what they are. So the ones here, where my mouse is pointing to now, these are the right pulmonary veins. The ones on the left are the left pulmonary veins. So veins usually bring blood into the body. So these bring oxygenated blood from the lungs into the atrium, which then goes down the left ventricle and then pumped through the arch of the aorta. And then you have the mid-carotid artery, you have the subclavian, and the brachiocephalic as well, which are the 3 trunks that come off the arch of the aorta, and I'll go into a bit more detail on the 3. So the main key aspect of these 2 are the right pulmonary veins. So imagine the atrium brings blood from the lungs, and they are oxygenated blood, so it's bringing to the heart, so therefore they're veins. And these ones here, which are highlighted in blue on the right hand side, is the right pulmonary artery. So they basically take, swing back round, so medial, no, I think lateral is better. So these ones are the veins, and this one here is the artery. So they take blood towards the lungs from the pulmonary trunk. Right. So those are swinging back around. It's really hard, this thing. So there's 2 branches of that come off the pulmonary trunk. So the pulmonary trunk is this main branch here. Then you have the left pulmonary artery, which goes to the left lung, and then you have on the around the back we have this one here, which is the right pulmonary artery, which takes blood from the towards the right lung. Now, if we were to swing back around to the heart, so that's basically the basic surface anatomy. So you have the left atrium, right atrium, you have the left ventricle around the back, and here you have the right ventricle, which surrounds the whole of the nape front. Now, you might be wondering what these little yellowish, or this on this diagram, on this 3D model, is this greyish bit. And those are basically sulcus. They're basically layers of fat that surround the heart for protection. And yeah, that's all I can really think of what the jobs of them are. And they basically anchor these. They anchor the arteries and the veins, the coronary arteries and the coronary veins to the heart walls as well. Right, now before we carry on, one thing we want to be sure of is, if you look on the right here, so around here, so the heart, as I said before, is a muscular wall. It's made up of different layers. So the most inner layer in the heart is known as the endocardium. The thickest layer just outside of it, it's myocardium. Then you have something known as a visceral layer, which is basically like a thin layer of sheet. Then you have the parietal layer, which is the outer serous layer, and then you have the fibrous layer. Now the pericardial cavity is the space between the parietal layer and the visceral layer. And sometimes when patients have pericarditis, it's usually due to buildup of fluid or blood within this space here. And what surgeons do is they usually drain this via some sort of puncturing that area with a very special needle. They drain that fluid away. And pericarditis means that your heart cannot contract, because if this contains fluid, it means it makes the wall more rigid. It means that your heart, when it starts to beat and it starts to contract because it's a muscular wall, it won't be able to do the contraction as efficiently as it is meant to. So we have the endocardium, myocardium, then we have the visceral layer, parietal layer, and then we have the fibrous layer on the outside. And then the pericardial cavity is between the visceral and the parietal layer. Right, so if we bring back up the coronary arteries, is something that we need to go through. So the coronary arteries are basically arteries that supply the heart muscle. Right, so whenever you think of arteries, you always think of blood vessels that travel around your body. If you got your abdominal aorta, which can then split into various different ones, and they then go and supply the different parts of the body and different parts of the muscle. But then no one's really thought about what supplies the heart muscles, right? And it's a common mistake for us to think that because the heart contains blood, it's oxygenated blood from the left ventricle, you would almost as if expect that oxygen in there to diffuse into the muscular wall and provide it and meet its metabolic needs. But no, that's not the case, because the heart has its own vascular supply system, which is known as the coronary arteries and the coronary vein. So the coronary veins all drain back into the coronary sinus, which then drains back into the right ventricle, and so on and so on. So what you want to be looking at here is mainly this 3D model is just to give you a feel of what the heart looks like, but I don't think the arteries are very well explained. But for the understanding, I will point it out on the 3D model as well, but you want to divert your attention over to the right hand side of this bit here. So we're looking at the this artery here, the main red one that's going down through the middle, which separates the left and the right ventricles, and that's basically known as the left coronary artery. And left coronary artery can then be split into so the left coronary artery, to be precise, if I was to switch this around, is actually not shown in this image. It comes through there, and in this case the left atrium is covering over it, and then you can see two branches that come off it. Two branches are, there's one there and there's a main big one here. So the main big one here is the anterior intraventricular artery, and then this one here, these two little ones, are known as the circumflex artery. So you can see here, or you can call it LAD. Some people call it LAD, left anterior ventricular artery. So anterior intraventricular artery is this one here, and you've got the circumflex, and they both branch off from one branch, which is known as the left coronary artery, which is below, in this case, it's below the left atrium. Now, if we swing back around to the other side, right, that's a bit too much. Over here, what we have is another pair of arteries that goes around the back, just underneath the right ventricle, and this is referred to as the right coronary artery. And then you can see in the bottom, so there's the right coronary artery, the main one. So if I was to flip this around slightly, you can see that then splits into two different ones. You've got right marginal artery, and then one that goes around the back, which is commonly referred to as the posterior interventricular artery. So in this image on the right, you can see this. So if you follow the mouse trail, you have the right coronary artery coming down, and you've got branches that come off it, but the right coronary artery comes down, and then it splits into the right marginal artery, and then it goes around the back. So this orangey faded color means that what it's trying to represent is the arteries on the posterior surface of the heart. So if I was to go back to the 3D model, so you can see the right marginal artery is there, and then goes around the back. Goes around the back, and then down this way. So it goes around the back, there's the right marginal artery, and then it goes down around this way to form the posterior interventricular artery, which is shown here, which is faded color here. So that's the basic anatomy of the arteries of the heart. So just to recap, so far what we've gone through, and there is more to go through. It's the so far what we've done is we've gone through the left atrium, the right atrium. We have the right ventricle on the front, and then around the posterior, on the back. Around here we have the left ventricle. So here's a posterior view of the left atrium, and then the right atrium. Here we have the superior vena cava, which drains deoxygenated blood from the brain and the upper extremities of the body into the right atrium, and then here we have this hole here is the inferior vena cava, which brings in deoxygenated blood from the body. Here we have the valves, which is known as the right pulmonary vein, left pulmonary vein, and they basically bring in blood from the left lung and the right lung, so oxygenated blood into the left atrium. And then around the front we have the, so if I was to go back, we have the pulmonary trunk, which has two branches. We have the right pulmonary artery and the left pulmonary artery. And the main one that comes off is the most important one. It's the arch of aorta, so it's the aortic valve, which comes from the left, connected to the left ventricle, and pumps blood around to the extreme of the body. And then you have the different valves that come off it. We have the internal carotid, brachiocephalic, and then we have the subclavian as well. Now, in terms of the arteries that supply the coronary arteries that supply the heart, the main one here is behind the flap, or the underneath the auricle, which is referred to as the auricle of this earlobe kind of thing. It's referred to as the auricle of the left atrium. This you can see this ridges, and if anyone just asks you in the anatomy lab what this is, it's known as the auricle. Forgot to mention earlier. So underneath that you have the left coronary artery, which then splits into circumflex artery around the back, which you can follow down here. Go down, splits into circumflex artery here. If you follow that down where the mouse is, the main one goes straight down, and this is known as the anterior interventricular artery. Now, we have another one which comes across the side of the right atrium, which is known as the right coronary artery, and that splits into various different branches, but the main two branches that you want to be aware of is it comes around the back and it splits into a right marginal artery, and then it goes right around the back where it splits into the posterior, this bit here where the mouse is pointing, just above the blue veins. It's the posterior interventricular artery, which supplies the ventricles, the left ventricle and the back of the right ventricle. So you get a fair idea of what the heart looks like. Now, if we were to dissect this open, before I do that, I think I should go through the veins that supply the coronary heart. So bear with me, let me just get an image up of the coronary artery. So I have to drag this along here and make this a bit bigger so you get your view much more clearer. So here we have the veins of the heart, and if I go back to the anterior view, so you can see the aortic arch, the superior vena cava, the right atrium, the left auricle of the left atrium, the pulmonary trunk. So what we have here, the main big one that comes down here next to the anterior intraventricular artery is known as the great cardiac vein. Around the back, which is the most important one, the big one, and it's really big in diameter, so when you do get into the anatomy lab you can easily, almost visibly see this. It's now referred to as the coronary sinus, and the coronary sinus then drains into this an area within the right ventricle. So that brings deoxygenated blood back, deoxygenated blood of heart back into the right ventricle, which then goes down to the right ventricle and pumped away to the lungs to become refilled with oxygen again. Now over here, this middle thing that goes down, the blue one, is known as the middle cardiac vein, which is shown here posterior. So the faded line means it's on the back posterior side. So the main thing you want to be aware of is you have the main big one on the anterior side, which is this one, is known as a great cardiac vein. The posterior side contains the coronary sinus, and off the coronary sinus comes the middle cardiac vein. And then you have the small cardiac vein, as well as the, so if I was to go lateral, if I was to go back to medial, so these ones here, the blue ones, This is near just below the right ventricle. And you can see here it's labeled as the small cardiac vein. So, I mean, that's the anatomy of the surface anatomy of the heart and what it looks like. So if we were to dissect this and go in a bit more detail of the different views. Now, if I get a clearer view of what it looks like when it's dissected from the top. Right, so if I hide this and go bring this image back up. So here you can see the different layers of the different muscle walls that I was referring to. So this thick bit here, which my mouse is pointing to now, is referred to as a myocardium. But inside the myocardium, the lining is known as the endocardium. If I'll zoom in, the endocardium is this bit here. The myocardium's here. Then if we bring it back up, then you have the visceral layer, which is shown here. And then you have the parietal and then fibrous layer on the outside. So if we go back, so what we have here, this middle bit is made up of the myocardium, so thick muscle. Also is referred to as the intraventricular septum. Then you have what's known as these spongy regions around the bottom here, which is referred to as the trabecular carne. Then you have this is the main valve that controls, almost like a gate mechanism, which controls the flow of blood from one region of the heart to the other. So in this case, it controls the region of blood flow from the right ventricle down into the right atrium down into the right ventricle, and these are referred to as tricuspid valves, or you can call it the right atrioventricular valve, which I find much easier because I tend to get the tricuspid and the bicuspid really confused when I do tend to talk about the anatomy of the heart. So the trabecular carne, then we have the interventricular septum. We have what's known as these muscle layers known as chordae tendineae, which is these little white elastic fiber kind of thing, which is attached to the muscular wall, and they hold the valves in place basically. Then if I was to go inferior, slightly bring it back up, you can see the different valves here. So this is the pulmonary trunk. So you can see that this is known as the pulmonary semilunar valve, and this is this here, this white bit here where my mouse is pointing to now. It is the valve that controls blood flow from the left ventricle into the aorta, and they're referred to as the semilunar valves. Right? Sometimes these valves can be referred to as different names, but they all mean the same thing, and it really depends on the language. The Americans refer to them differently compared to the UK. Now, there's the coronary sinus bit that I was talking about, where through which the that's the inferior vena cava hole. The coronary sinus is meant to be somewhere around here, which drains the oxygenated blood from the heart. And yeah, so that's what the inside of a heart looks like. If I was to go into a bit more detail, so if you look over on the right, this white bit here, which links or holds together the pulmonary trunk and the aortic arch, is known as the ligamentum arteriosum. Then you have over here what's known as the pectinate muscles, and apart from that, I think I've covered most of the anatomy of the heart. And if you do find these videos interesting, please do give a like. Share the video with your friends, people who are interested in learning anatomy, or they find it difficult to learn it from a book. I tend to learn it by visualizing and making videos. So please do hit the like and subscribe button, and it's been a pleasure producing this video, and I hope you find it interesting as well, learning from it. And thank you once again.